Hello, listeners. Welcome to Views on Health. And back with us on the program tonight is Dr. Chathuri Suraweera, consultant psychiatrist, National Hospital of Sri Lanka, and a senior lecturer in psychiatry, Faculty of Medicine, University of Colombo. Having focused on mental well-being and mental ill health on the program last time around, today the topic is maternal mental health. A very interesting topic and certainly important because of the well-being of a pregnant woman. With that brief introduction, may I ask you, Doctor, to please introduce the topic of maternal mental health?
Yes, maternal mental health is to do with the mental health of pregnant women as well as after delivery. So the mothers, let's say up to 1 year of delivery. So it's very, very important because although we all know that it's a very happy moment for the mother and for the family, particularly when you know that you're pregnant and also when you have given birth to your child, yes, it is very happy and one of the things that females would be waiting. But it has got complicated now because particularly in Sri Lanka, it's not only about the baby, it's not only about the mother, it's not only even about the family, it's about the social expectations, cultural expectations, and lot of myths and beliefs, and so many people are involved, revolving around this issue. And also, on the other hand, the woman's life is going to change forever. The body shape, the responsibilities, the way they saw themselves, and the whole life is going to basically turn upside down. And there are the physiological changes, the hormonal changes which are taking place. So all of these factors are going to play a role in the mental health of the mother when they're pregnant and after delivery. So that's why the specific area of maternal mental health and maternal mental health issues are there.
Doctor, from which point of a woman getting pregnant should she focus on mental health as well? Because all the time it's physical. You have to eat this, you should not eat that. You need to ensure you walk so much or exercise or do housework or something. If you're doing a regular job and you're going to be stationary in your office, then make sure you walk or do this after work. So it's all physical. Right, and then yes, watch some TV, listen to music, go out with your husband, your partner, whatever, and then it's all the physical part with mostly. So where does the mental well-being come in for a pregnant woman?
Before getting pregnant. Because now let's say I'll give you a simple example. There are conflicts between the partners, and one way of saving the marriage is to get pregnant. That happens often, right? And then they think that, okay, the problems will get solved after the little bundle of joy comes in. And then to see that everything gets worse and you go and have another baby. So that's the story. So just because there are issues, that is, the bundle of joy is not going to solve that, because it's going to add to the whole heap of problems there. So that's why I said it should be before. You have to sort out your problems. And if you're stressed, you have to seek professional help to make it less, because we all know scientifically, if you're too anxious, if you're suffering from mental illnesses untreated for a long time, that's not good for the fetus. That is for the pregnancy. And let's say you're being treated for pregnancy, treated for depression or anxiety, most people think that you should be off the medications, and they stop their medication. With all the stressors of pregnancy and the childbirth, the chances of you coming back with that illness is very high. Let's say you have been having depression, and the chances are that you might actually get a postpartum depressive episode. So, but we do the exact opposite. We stop taking the medication. And sometimes we see so many people giving wrong advice to stop the medication. No, there are many safe drugs which can be taken during pregnancy and during lactation for mental illnesses, and it would do a lot of good to the baby and for the mother. For example, if you're having depression, if you're anxious during the pregnancy, that is going to have harmful effects on the baby, and as well as you're not able to take care of yourself. Just like I said last time, I won't be able to go to the hospital, I would be lazy, I won't be if there is loss of appetite, I won't be taking a good diet, which again going to have an impact on the baby directly and indirectly. So that's why it's really, really important that you are mentally prepared. That's why teen pregnancy is a risk factor, because you have to be mentally and physiologically prepared for that. And same with the postpartum period as well. So it's not at the point of getting pregnant, it has to be before that.
And say once you deliver your baby, thereafter the postpartum?
Yes. There, again, as I mentioned, it's so complicated. There are 3 significant entities of mental illnesses that is going to come. One is maternal blues, the other one is postpartum depression, and the other one is postpartum psychosis. Postpartum blues or maternal blues, that is going to occur in the first week, within the first 2-3 days, and it's going to resolve spontaneously. And the mother might be the mood might be changing, sometimes irritable, sometimes crying. It's going to be self-limiting, but then it might be an early sign of one of the important ones like the postpartum psychosis or postpartum depression.
Thank you, Doctor. Very interesting. What happens to the baby then?
Usually in the maternal blues, nothing happens to the baby. Like the mother is able to actually look after the baby. There might be some amount of functional impairment, but there is no risk or anything like that. And we usually don't have to treat either. But it's important to note it resolves spontaneously, but you have to go to a professional because it might be an early sign of something more important. Then comes the postpartum depression, which is very, very important. It's common. A lot of mothers undergo this. They're feeling sad. They don't want to look at the baby. They don't want to take care of the baby. And they might actually refuse the baby, sleeping difficulties, feeling very lethargic, lazy. And to add to this, the people around them do not realize that this is because of an illness. They might think that this mother is being lazy, not being responsible, and not breastfeeding the baby. So how can you do this? That's the kind of comments that's going to come. And it's going to be a lot of things with the mother-in-law, the mother, the husband, everybody. And the mother is going to be blamed here. So it's not the time to blame. It's actually the time to take to a professional again. And a lot of times I have seen that mothers are having issues with regards to breastfeeding because we are led to believe that that's something so natural and every mother should have breast milk freely. But that might not be the case. And when everybody is sort of pressurizing, yes, breastfeeding should be done. There's no question about it. But not all the mothers are able to do it the way that is required to meet the standards, let's say. And when we prompt them too much and when we are not doing anything nicely, the mother will get stressed and the breast milk is going to further deteriorate. And if there are issues there, that might lead to a depression as well. And the important thing is, in postpartum depression, the mother might get the thoughts that, that you don't want to live anymore, as with any depressive illness, and that the baby might be left unattended if you are not there. So there is a risk to the mother as well as to the baby there. So that's very important to keep in mind. So there are very safe drugs that can be given in lactation. So it doesn't have to be postpartum depression. It could be maternity blues, but still you don't know. You are not at a position to say that. So it's best that you seek professional advice and see why is she getting so angry at the slightest thing? Why is she very irritable? And at the next moment she's crying and there are sleeping difficulties. So it's not the normal behavior. She's not like this. So you have to seek help there. And if there is a dramatic change in the mother, like, saying things that never happened, and expressing thought that she never expressed, like the baby is well and very well, weight gain is good, but she's like, the baby is having a serious illness. So that's totally contradicting to what is in real. So then the mother might be having abnormal thoughts there. And the mother might be saying like, baby is having a serious illness or something like that. And responding to unseen stimuli. So that might be postpartum psychosis again, which is mostly seen in the first week or so. But it could happen at any time, although I'm giving certain specific time periods. So there also, again, there is a risk to the mother as well as to the baby. And sometimes in really severe cases, we might have to actually separate the mother and the baby. That is because early treatment has not been sought. Because if it has been sought at the point of noticing subtle changes, irritability, poor sleep, not the usual person that I used to know, then it's different than to the point where she is like, neglecting the baby, refusing the baby. So that's severe illness. And the important thing is, there are things that can be done to prevent it. And sometimes we manage them at home also, we do not need to admit. So that's why we have to be very much aware of these things.
So we go back to the point where before a woman gets pregnant, and if she's having any issues in the sense that she's stressed out, or there are conflicts with the partner or the spouse or with anybody else, all that has got to be put right before she becomes pregnant. I mean, ideally, that should be the scenario.
Ideally, yes.
So that can be treated, doctor, is what you say.
Yeah, now those are some social and relationship issues. So it's best if you put right before going for a pregnancy. As well as if you're having any mental illness, you have to treat that and and be on proper medications, because sometimes they are on medications where you should not be getting pregnant, and once they come and tell us that, doctor, we need to get pregnant, we change the medications to safe medications. So that's something that we have to keep in mind. So it's best if those things are corrected, because it's going to be additional stressors to the mother.
Doctor, I don't know how you will view this question. Would any of these conditions have an impact on the fetus if she becomes pregnant?
That's what I was saying earlier. If the mother is very, very anxious, stressed, yes, it might have some issues. And also in severe mental illnesses also, if they are not controlled, it might have. There are proven studies to say that there is an impact, and later on the baby might have certain issues, not really physical issues, but other issues. And also during the postpartum period, let's say the mother is not able to take care of the baby and the baby is not there, so there might be attachment issues and so on. And the mother might be irritable, sometimes scolds the baby, so these things might happen. So yes, directly and indirectly there might be issues. And when we prescribe medications also, that's something that we really consider, the benefits and the risk of prescribing. Risk to the baby that might be there, as opposed to the advantages of getting this cured.
And even after the baby is born, and then if this condition that you prescribed of the maternal blues and the postpartum depression, the postpartum psychosis, it's treatable with medication.
Yes, it is.
That is what important for our listeners to know,
Yes.
that it is treatable.
It is treatable. And maternity blues might not even need any treatment per se, but you have to get yourself checked because it might be an early sign of maternal depression or maternal postpartum psychosis. So, and there are like doctors available, like, most of the big hospitals up to the level of base hospitals and district hospitals have a psychiatrist in the government sector, and there are consultants in the private sector as well. And if not, the maternal health services in Sri Lanka are very, very strong. So tell your midwife. Sometimes you might not be registered with the MOH clinic, but get yourself registered, because the midwives comes and gives a lot of things, and they have this knowledge of how to detect most of them, like at least the gross abnormalities as well. And also, like when they come and do the home visits, they might be able to rectify the breastfeeding issues and so on, which might prevent you from going to a depression because of breastfeeding issues. And like there are so many advices which are going to come when you're a new mother, like, one mother-in-law might say you have to feed this way, the mother might say you have to feed this way, and then the husband might say totally something else, and then the new mother is going to be really numb there. And so it's easy to prevent conflicts by sticking to what the doctor says with regards to food or bathing or whatever. Okay, then you're sticking to the doctor. So hopefully your mother-in-law and the mother will not get upset, because we see a lot of times mothers get depressed because those issues as well.
I know, because you listen to one and you don't listen to the other. It can definitely, aggravate the situation. And so what is comforting here is that it can be treated medically.
Yes.
And so this medication has been taken for a long period of time, or within a certain time frame. It'll, of course, it differs from person to person, and the level of, sort of anxiety they have and issues they have. So based on that, of course, but is it something that a long-term process?
Yeah, usually one has to keep in mind, after we start treatment for postpartum depression or postpartum psychosis, it takes about 1 to 2 weeks for the medications to start acting. So please don't go from doctor to doctor because you didn't get better during the first few days. Even if you go to the next doctor, it will be the same. So that's one. And the two is, some mild side effects might appear before you get better. Right? So don't worry about that. It will go away within about 1 to 2 weeks. And the other thing is, yes, you have to treat, if it is the first depressive episode, usually what we say is 6 to 9 months. You will definitely start feeling better after about 1 month of treatment, and most patients stop their treatment. But you're not fully cured. It's not gone from the system, if I'm to put it in simple language. So therefore, you have to just get rid of it. So to stabilize a patient, you have to take the medications at least for about 6 months. But in certain cases, you might have to cover the whole postpartum period, like the first year or so. But this depends on the severity, the number of episodes that a particular mother has had, if there is a past history, and so many other things. So, but the simple advice is, don't stop the medications until your doctor stops it.
Thank you very much, Doctor, because that is a very important question, point you made, because most patients in Sri Lanka, irrespective of what their ailment is, when they feel better, they stop medication. And then the course that they're supposed to take is stopped 3/4 way or something. And even that quarter bit that is not been taken needs to be taken. And this is something that other consultants also have been emphasizing on over this series of programs, that medication once prescribed for a period should be taken irrespective of the outcome. So I hope our listeners will take note of this point too, very important, that your medication has got to be taken, the whole course, and not stopped at some point in time if you think you're feeling better. Doctor, are these medications freely available in the sense that is there difficulty to get them, or in the government service they're given free of charge?
Yes, the most medication that I mentioned about which are given during the pregnancy, the safe medications for depression, anxiety, psychosis, whatever the cause is available in the government sector. More medications are available in the private sector, but then that would not mean anything because the ones that are available in the government sector are quite good enough and also adequate. So you don't have to go for something, you don't have to buy something from outside. So it's adequate.
Yeah, just one more question, doctor. Once the mother is taking this and she's nursing the baby, there's no issue there?
No, because that's why I said there are very safe medications which can be used during the pregnancy as well as during the postpartum period. And if you're on any medications and you want to get pregnant, it's always best that you tell your psychiatrist about it. So if you are on any medication, any such medication that needs to be changed, your doctor can change it. And the other thing is, there are very few medications, about 2-3 medications where we just don't have any other choice. They are having very severe mental illness, so they have to be on these medications. But even with those medications, it's okay to be pregnant, but you might not be able to breastfeed. But this is very, very rare, exceptional circumstances. I'm just telling that because based on that, some people might tell you not to take the medication, not to breastfeed, and so on. So again, most of the medications, 99% of the time, are safe. There are safe medications that can be given during pregnancy and lactation. And if there is an exception, your doctor would definitely tell you.
Your take-home message.
Mental health is very, very important, not only to the mother as well as to the fetus, and then in the postpartum period for the baby as well. And there can be mental health issues which are specifically seen during the pregnancy and the postpartum period. And there are effective measures that can be taken to rectify those. Sometimes it might be medication, sometimes psychological therapies. So if there is an issue that you're experiencing or you're observing in your loved ones, please seek help.
Thank you, Doctor. And we end this very interesting discussion on maternal mental health as articulated by Dr. Chathuri Suraweera, consultant psychiatrist, National Hospital of Sri Lanka in Colombo, and senior lecturer in psychiatry, Faculty of Medicine, University of Colombo. Thank you once again, Doctor, for being with us on the program.
Thank you.
And sharing expertise with our listeners. Thank you so much. Thank you to Manjula Sinviratna for technical assistance. I'm Fatima Razikada saying good night. And about your company next Monday, same time on Views on Health.